not depression. And I am Dr. Achina Stein, your host on What If It's Not Depression podcast and show. I am interviewing Dr. Erin Amato today, and she is an award-winning speaker, psychiatrist, and mother of 6. She's an interventional psychiatrist in Billings, Montana, who helps people with treatment-resistant depression using TMS, ketamine, and integrative mind-body lifestyle programs. Her mission is to help people find better mood and brain health through solutions beyond the prescription pad. Dr. Amato is passionate about finding cutting-edge, innovative, and integrative ways to prevent and treat mental health disorders that have not responded to traditional interventions. She received training in TMS, which is Transcranial Magnetic Stimulation, and has been performing TMS for treatment-resistant depression since 2015. She's been providing ketamine infusion therapy for treatment of depression and other mental health conditions since April of 2016. She's an integrative psychiatrist who blends traditional treatment tools like medication and talk therapy and interventional treatments like ketamine and TMS with specialized functional medicine testing, nutritional supplementation, and lifestyle education interventions to design personalized treatment approaches that target the root causes of illness. My kind of gal. So welcome, Dr. Amato. I'm so happy for you to be here, especially, I know you were juggling with your niece being born. You were a little worried you wouldn't be able to make it, but yay, we did it.
Yes, it all worked out.
I know.
Thanks for having me.
Oh, you're welcome. I'm so excited. Yeah. So tell me more about what got you into, I know, we always choose medicine and psychiatry because of our interests, but then we take a detour sometimes in our careers. And, I would love to hear more about the detour that you made that resulted in your current practice of psychiatry, a holistic and functional psychiatry, as I would call it. Yeah.
Yes. So I was trained very traditionally with a lot of focus on the use of medications and talk therapy to some degree with my training. And that's the way I practiced for the first several years after getting out of residency and fellowship. But I went through the experience almost 6 years ago of losing my first patient to suicide. And even though as psychiatrists, we know that that's a potential possibility, it was very devastating. It was very difficult. I did not feel very prepared for that experience. And it really made me reflect on how I was practicing and thinking about all the other patients I was working with who, despite all of my best efforts and applying my best knowledge and skills with medications or talk therapy, they still weren't getting better. And so that really prompted me to think about what else is out there and start investigating. And so around that time, ketamine was very new, I think, in the psychiatric world and in the research. And so I started looking into that as a possibility. And same with TMS. TMS is a fairly young treatment still. It was FDA cleared in 2008. But around the time I started looking into it, it was finally being covered by some insurances. So it was becoming more accessible to patients. So that was the start of where I was looking into those two treatments. And just timing wise, it was also where I started to come across the world of functional medicine and functional or integrative psychiatry.
Right. So you said you said it was really new. What year are you talking about?
So it was FDA TMS. Yes. It was FDA cleared in 2008. And when it was initially approved, it was not covered by any insurances at all. And so it was, there weren't very many people around the country that were doing it still. And just because of not being covered, it was difficult for patients to often cover themselves financially. So that started to finally move at the time that I was looking into that treatment.
So yeah, I'm so sorry for your loss about your patient. I actually had a similar experience when I was a resident, and it was absolutely devastating. It made me wonder. It really made me wonder, like, oh my gosh, is this what I really want to do. I mean,
Right.
am I competent enough to take care of these people? And this is as a resident. We had discharged someone from the hospital. And what made it so devastating for me is I actually chose him as a case study to get to know him from a cultural standpoint. He was Vietnamese. And I actually presented his case from a cultural psychiatry standpoint, and presented all of this information after sitting with him for so long, for so many sessions, because, more than I would normally do. And then
Right.
he committed suicide upon discharge. And I was like, oh my gosh. Like,
Yeah.
and I was a first year resident. So it
Oh,
totally devastated me. But
yeah.
obviously I recovered, but I just really, yeah. So I know what it feels like to lose
Mhm.
a patient, and especially when you're blindsided like that.
Yeah. Yeah, definitely. Yeah.
Yeah. So you started doing TMS and ketamine therapy. Tell us more about those types of interventions, for our audience who don't know anything about these two types of interventional types of treatment.
Well, they're both treatments that are being used primarily for treatment-resistant depression. And I'll start first with TMS and kind of show you some differences between the two because they are quite different. So TMS works by stimulating an area of the brain that's been identified as being slowed or sluggish when people are dealing with depression. And it delivers MRI strength magnetic pulses over that particular area of the brain. And the treatments themselves, it used to be when it very first started, the treatments were about 40 minutes in length. Then the technology changed to where the treatments could be done in 20 minutes. And then more recent developments have even allowed for a treatment called theta burst, where the treatment is condensed into even 5 minutes. And so we're really seeing continued evolution in the field. And it's a series that spans across about 9 weeks. And I know that sounds daunting to people when I first tell them, but really the time actually goes quite quickly. And what we do is we deliver treatments 5 days a week. The treatments themselves, again, they range from about 10 or 15 minutes of being in the office and getting the treatment to about 30. There's no anesthesia required. So it's different from ECT. Sometimes people wonder what's the difference between TMS and ECT.
Right.
You don't have to go under anesthesia. You don't have to stop your normal daily activities. People can drive to and from their TMS treatments. So often we're doing those on people's lunch hour from work or catching them after work or after school. But it really is a treatment that is, at least in terms of the insurance approval still, it's for major depressive disorder, usually in cases where people have failed at least 2 to 4 antidepressant treatments, which for most of the people I'm seeing, that's really what their experience has already been. And the main side effect we see with that is headache that usually ends up being limited to just for the first few days of treatment. It's really well tolerated for the most part. And we see in a lot of cases, we see some pretty transformational results, even for people who have suffered from depression for decades and have been on medication after medication. So that has been a wonderful thing to be able to offer to people.
Do people notice that there is an improvement at some point in the course of these 9 weeks, sooner than, how long do you notice an improvement?
It's most common that we see it a few weeks into the treatment course, although just like any bell curve, we have some people that are very early responders and it's within the first week that they can see some difference, and others are later responders where it's at the end of treatment. But really, I would say it's week 3 or 4 where commonly we're really starting to see something meaningful.
Oh, that's great. And
Yeah.
then what happens after these 9 weeks?
So after that 9 weeks, they often go back to working with whoever was their primary psychiatric clinician. We really emphasize the importance of talk therapy throughout the course of the TMS, but beyond that. And the reasons for that are one way that TMS seems to work for people is it enhances neuroplasticity. So the ability of the brain to learn material in new ways, or for the brain to be more flexible in the way that it perceives or thinks of things. So we really like emphasizing the use of CBT, or cognitive behavioral therapy, during the course of the TMS, and a lot of people find benefit from that. But therapy is so important even beyond finishing TMS, because when people have been depressed for years or decades, often they don't know how to pick up the pieces and live life differently. And
Right.
so therapy can help with that continuation of rebuilding life. And I also really like emphasizing all of the other integrative health things that people can do once they feel better and they feel like they have more energy or motivation, or they can think more clearly. It becomes easier to maybe try some healthy dietary changes or implement some sort of regular exercise program that can just build upon those results of TMS and enhance their mood and their functioning even further.
Absolutely. As we know that the treatments with depression treatment with antidepressants, are really suppressing symptoms, and it's because they're not working that they're not really getting improvement. But if you get to the root causes and use TMS and other interventions, that at least the TMS will uncover the depression, but then in order to maintain it, if you get to the root causes of depression, then you'll probably have more success on a long-term basis.
Yes, I absolutely agree with that.
Yeah,
yes.
That's great. So what percentage of people would you say improve that come for this treatment for TMS?
Well, within our clinic, our results match what's been reported in a lot of the TMS literature. So it's around a 70% combined improvement and response rate. So by improvement, I mean at least 50% improvement in symptoms. And by remission, I mean that by the time people are done with their course of TMS, they may have very minimal depression treatments at that point. So when we're talking about this population that has been treatment resistant, and I don't actually love that term.
No, I don't either.
To see someone who's had 50% improvement in their mood symptoms, and along with that improvement in their functioning, that's really profound.
So, absolutely, especially if they haven't had it at all prior to that. So then do any of your patients have to return for a second round of these 9 weeks?
Sometimes that does happen, that people come back for an entire round. Another strategy for trying to help people maintain their results is doing maintenance TMS. One challenge with that is, up to this point, insurances have not covered maintenance TMS. But I have had some people do that, and it's really individual how we approach that. Some people, we maybe do weekly TMS treatments, maybe it's twice a month. I've had some people where they get out maybe 2 months from their initial treatment series, and they're not doing as well. They're not back to square one, but they can just feel they're not doing quite as well. And so we'll do a booster cluster of maybe 3 to 5 treatments to get them back on their feet, and then they're able to maintain. So like I said, it's still a young field. So even things like maintenance strategies, there's still research going on about what's the best approach. And even beyond that, I think so many of these treatments have to be tailored personally to the patients.
Absolutely. And is there, what would you say if somebody wanted to pay cash for it, write a check? How much would you say it costs to have, 9 weeks of treatment?
It's really variable depending on clinic. It would be hard for me to speak to what that price tag might look like. But if there's anyone in your audience who's interested in that, I would encourage them to seek out a TMS clinic in their region and ask them those questions. But if people have a history, like I said, of major depressive disorder, if they've tried 2 to 4 medications. Many people have tried more than that.
Mhm.
And if most insurances to cover it, they require that people are in a pretty severe depressive episode. It's not for mild depression.
Right.
But in those cases, insurance usually covers a large amount of the cost of the treatment.
Yeah, that's great. That's great
Yeah.
to know. So yeah, just so the audience in my region knows, Butler Hospital does offer TMS treatments. So if that's something that you're interested in or know someone who might be interested in it, you're welcome to contact me and I'd be glad to give you that information. So let's move on to ketamine.
Mm-hmm.
Tell us
Ketamine.
more about that. Yeah.
Yes. So ketamine has been another amazing treatment to be able to offer. And when it works, it is amazing because as opposed to that 9-week course of TMS, or opposed to starting an antidepressant medication and saying, okay, we need to wait 4 to 6 weeks to see if this works. And if it doesn't, then you come back and they usually increase the dose and maybe increase the dose again or switch to another medication. And I mean, that process can go on for months.
Right.
With ketamine, what we typically do is my clinic starts with a series of 6 treatments that we do 2 treatments a week for 3 weeks. And there are different delivery methods for ketamine. It can be done by an IV infusion. It can be done by an intramuscular injection or shot. There are some cases where people are doing some lozenges, and that's usually in combination with working with a therapist at the same time that people are doing that oral ketamine. And then there's now an FDA-approved derivative of ketamine called S-ketamine. The brand name of it is bravado, and that's an intranasal form of ketamine. And so, but with our clinic, we do those 6 treatments, and a lot of the media out there that has covered ketamine, sometimes they feature stories where people have one treatment and they have this immediate transformational experience. And we do see that occasionally, but it is more common, just like with TMS, to really notice differences as you get more into the middle of the treatment series.
Right.
But that could be, infusion 3 or infusion 4. So we're talking 2 weeks into this treatment. And one of the first things that often responds with ketamine is that for people who are having suicidal thoughts, that's often one of the first things that responds. And so to see someone go from being in a severe depression or a crisis state and having suicidal thoughts to a week or 2 into it, no longer having those, it's an amazing tool to be able to offer to people.
That's great. How many IV infusions would you have to do in a week?
As far as the patient going through the series?
Correct. Like
Okay.
For the suicidal thoughts, would you have like 3 or 4 sessions in a week?
We typically do 2.
Okay.
Yeah, and that's something that we've modified based on what's come back in the research, that 2 seems to be better than 3. We used to do 3, but 2 seems to work well, and it gives people in between time with those infusions to really consolidate the effects of the ketamine. And I even encourage that, again, that people go through therapy during the treatment series, but I like people to have a therapy session on their off days in between when they've done the ketamine, so they really have a chance to process or integrate anything that's come up during the infusions.
That's great. So you said you offer all the different types of modalities to provide the ketamine. Which would you say is most effective?
So for years, we did primarily IV. There were some cases where we would do IM if it was maybe a patient who was visiting Montana from out of state and they had done IM with another clinic out of state. Or in cases where we just could not get good access to start an IV, then sometimes we would do IM. And we've just recently started doing Spravato in our clinic. We're about 9 treatments in with our first patient, and we're seeing good results with that. But IV is, I like the flexibility of IV. We have a lot more control over the dosing. We have the ability to turn the medicine off if for whatever reason, if someone has a side effect or a problem with it, if they have a medical condition where they're not responding well to the effects of the ketamine, we're able to turn it off. Whereas with IM or with the intranasal, once you've dosed that, it's on board until it runs its course to the end of the infusion.
Wow, that's fantastic. So, yeah, and the nasal spray is called bravado. It's bravado.
Bravado.
Bravado. Yeah.
Yes.
And you said you have had 9 patients so far using that method.
Well, one patient who's now on her 9th treatment with Bravado.
Oh, okay.
So it's very new for us to be working with it. We're going to be starting our 2nd Bravado patient next week.
Mm-hmm.
So, and that's one it is covered by insurance, but because it is a newer medication, in the first couple of years, it was just very difficult to navigate the whole insurance world with that medication. But I think things are starting to improve with that to where it is more accessible to more people. But there are more strict criteria since you're working with insurance of what they require to get that treatment. So you have to have a diagnosis of major depressive disorder. You have to stay on an antidepressant or be on an antidepressant throughout the course of being on Spravato. And there are some other requirements too, whereas with the IV, we're able to treat bipolar depression. We're able to treat PTSD because there's really benefit for PTSD in a lot of cases too. So again, more flexibility with where we're able to make judgments for who's appropriate to receive that treatment.
Right. So is the Spravato given as a nasal spray on a daily basis, and you have to come to the office for that, or do they take that home?
It's done in the office, and there are some pretty strict criteria about monitoring with that. And so there are 2 to 3 cartridges of the S-ketamine, depending on the dose that you're using. And so you use one cartridge, wait 5 minutes, use another cartridge in both nostrils, and then potentially another round of the cartridge dosing. And blood pressure is checked at the beginning, has to be checked at 40 minutes, has to be checked at the end. Patients are required to stay in the office for 120 minutes from the time of the first administration to the end. And some people are already feeling pretty awake and alert and ready to go, but the requirement is stay in the office for 120 minutes.
Yeah. And why is that? What are you looking for that might happen?
So there are concerns about watching for sedation because the ketamine does have an effect of potentially making people sleepy, a little bit groggy, and also dissociation. So a feeling of disconnection. It can be a feeling of disconnection from the normal feeling of time and space, or sense of being in the room, or sense of being in your body. We don't see the dissociation being as intense with the Spravato as it tends to be with the IV administration or with IM. And the dissociation is actually an important therapeutic component of the effect of ketamine. And this is something that I've learned over the years of using this, because 6 years ago, when I started doing treatments and when most of my colleagues around the country were doing ketamine, we all stayed at the same dosing ratio based on weight for all the infusions. And we did still see benefit. But over time, what most of us have done is we will now titrate the dose, because there's some good research showing that for some people, the suicidal thoughts or the severe depressive symptoms respond once you get into the higher dosing ranges of the ketamine. So we do dose it and titrate it like that, but there's a lot of power for some people in the dissociative effect. There's a psychospiritual aspect of the healing that can happen with ketamine. And we see that more with IV and IM versus the intranasal dosing, because you just don't get the level of absorption of the dose and the intensity of effect with Spravato or compounded intranasal.
Right. That's interesting. I wonder if the effect has to do in the same way that you might get benefit from hypnosis in some conditions as well, because of that dissociative aspect. A
Mhm.
lot of spiritual healers, uh, when they do a healing, they do create this dissociative aspect, connection,
Mhm.
so that it requires some level of dissociation to have some healing. So
Right.
that's so interesting.
Yeah.
Yeah. So, and have you been working with any other psychedelic types of drugs, or are you looking into other options as well?
Well, I'm certainly trying to stay on the forefront and learning everything I can, because there's just so many exciting things happening in the world of the psychedelic medicine research. There are over 20 university or academic programs at this point, including institutions like Johns Hopkins, that have departments or studies dedicated to psychedelic medicine.
Cool.
And in some cases, like take, for example, MDMA, that's in phase 3 clinical trials, profound outcomes in the research for PTSD. And so I'm so excited that these things are on the horizon. And I just enrolled last week in the first class of the psychotherapy ketamine training that's being offered through the Integrative Psychiatry Institute. So
Wow, that's great.
yeah, very excited about that.
That's great.
Yeah.
Yeah. So you have a whole team in your practice. Are you seeing patients for psychotherapy as well?
I am not, just because I'm really dedicating my practice at this point to ketamine and TMS and developing programs for integrative psychiatry, functional
Right.
psychiatry. So I do have a wonderful team. I have a few psychiatric PAs,
Mhm.
some psychiatric nurse practitioners. There's another psychiatrist in the practice. And then I have 2 therapists, one who is going through training in ketamine assisted psychotherapy, and
Mhm.
another who's finishing up her training in EMDR. And both of these, I think, are going to be such an amazing complement to the work that we're doing on the ketamine side.
Oh, that's fantastic.
Yeah.
That's fantastic. Yeah, I remember us talking a little bit about your one of your experiences that got you into this type of treatment is, I think you mentioned that your husband
Yes.
was suffering from depression. Would you be willing to share something about that?
Yeah, I'd be happy to. Uh, so my husband, and he's fine with me telling his story because he tells everybody too about his journey and the results he's had with different things. But he struggled with ADHD as a kid, really struggled in school, and he tells this story about how growing up, they used to talk about how, okay, if there's going to be a standardized test in school, make sure that you get up and you eat a really good breakfast so that your brain is working right, and so you do a good job. And so he remembers waking up in the morning and making himself pancakes and making this huge heap of pancakes, and then going off to school and just feeling like he just could not think straight. His brain was just not focused. And so for several years, he tried a variety of medications to target that.
Mhm.
Along with that, he struggled at times with some mood issues. But he encountered a lot of side effects and problems with medications. So there was a point where he just kind of threw up his hands and said, no, none of this is going to work. I'm going to try to find some natural interventions.
Mhm.
And then about 7 years ago, he experienced an accident while he was at the beach. He got stuck in kind of a riptide and was picked up by a wave and planted on his head, and kind of had almost a separation of a
Oh,
stretching of his neck from his shoulder. And he recalls seeing white and thinking to himself that he was going to die. And it took everything in him to kind of claw his way above the waves. And then he did make it out, and he immediately went to the ER, and they scanned him, and they didn't see anything obviously wrong with him. But that was kind of the marker of a downward spiral for him. And over the next several months, and even the next couple of years, he really started to experience profound depression, persistent suicidal thoughts. I didn't even know how bad it was at times because he knows I'm a psychiatrist, and he didn't necessarily want to disclose how bad it was even to me. He was having a lot of problems with memory and thinking. And this was right around the time where I started getting into functional medicine, and he was going to the conferences with me. He's not in medicine. He's not a doctor. He's actually an artist and does construction and property management. So, but he's always had a fascination with health. And so we would go to A4M conferences together and different things. And so he was learning along with me, and he's always been a very willing health adventurer or guinea pig for me to try things with. And he started working with a functional medicine doctor that I had worked with by meeting her in A4M. And she did a lot of her normal workup in the beginning with some of the functional medicine testing that looked at nutrients or looked at hormones. But one of the things she suggested was that he get tested for mold and that he get tested for Lyme. And at the time, I was new enough in functional medicine that I thought those were just really strange recommendations. I didn't see how those things would be relevant, because with mold, I was thinking, well, we live in Billings, Montana. It's a very arid climate. I don't see why there would be a mold issue. As far as Lyme, again, I was thinking, we live in Montana. Montana doesn't really have issues with Lyme. So it was early in my understanding of how these things could actually cause some profound psychiatric issues. So as he got several months into working with her, he finally got tested for those things. And for mold, he came up as being off the charts.
Wow.
For the 4 different types of mold that real-time labs tests for. And what we put together was, like I said, he does construction and property management, and he had been doing some remodeling on some very old apartments that were built in 1910 and had water damage. And so we identified those as being the source of the mold. And then he also tested positive for Lyme. And what we've put together is I did my residency and training in New York and the East Coast. I mean,
Yep.
that Lyme is very common there. We had even taken some family vacations up to Lake George, and he remembers having been bit by a tick and digging a tick out. But so started down the path of doing treatments for those, and it was a rough road. He experienced the Herxheimer reactions, and so it was so eye-opening for me to see what he went through in terms of his physical experience with the treatments and the psychiatric symptoms he experienced with those things. So, and luckily, I mean, one of the things that really did improve for him was the suicidal thoughts resolved by going through these treatments.
Right.
And his mood has improved to a degree. He still struggles, and he has tried, I mean, he's gone through all the things that we normally do in functional medicine by optimizing hormones, and he's cleaned up his diet. And he has really seen that changing his diet has been a profound aspect of clearing up his brain fog. Gluten is not his friend. It does not agree with him.
Well,
which,
those pancakes.
exactly. And it's so sad to think of all the years that he struggled when some changes may have made a big difference for him. But one thing he has found that has made a huge impact, probably the most impact of anything in his mental health, has been exercise.
Right.
Pretty intense exercise. He does CrossFit now, and that has really helped tremendously.
Right. Yeah, so I just want the audience to know is that Lyme's disease and mold are major root causes of major depression for people. Yeah. I've actually diagnosed, just because of getting a detailed history, I've been able to diagnose a major depression and say accurately that this type of depression, I even know what a Lyme depression looks like. It's like this type of depression is Lyme disease. I just know it. And then sure enough, you get testing and there it is. So, and with treatment, it goes away. And same thing with mold. So mold is a major root cause. I see so many patients with mold. And, so yeah, bravo. Yeah.
I'm
So
definitely a believer now after watching him go through that. So
absolutely. How's he doing now?
he's doing quite a bit better.
Oh,
Yeah.
good.
And like I said, he still struggles. And even this year, living in Montana, winter is a tough time for people with depression. And so, he was really trying to keep up with exercise. We even bought one of the happy lights for him to be using to help with light therapy. So like I said, he's game for trying a lot of things. And that's what I would encourage people to think of this as. It's a journey. It really is a journey in terms of experimenting with different things and finding what works for you, and just being open to trying something different that maybe you've never tried before. Maybe it is challenging for a period of time, but you may be surprised with how profound the changes can be.
Yeah, absolutely. Yeah, it really is looking at finding all the drivers of your mood symptoms, and there definitely is hope in affecting a change for people. So, I know that you have something that you wanted to share with our audience. I think it was a grocery list, right?
Yes, yes. So I'm actually in the process of kind of revamping my website, but the website is going to be moodrestorationinstitute.com. And on the website, I'm going to have a free download for people that has a grocery list of brain boosting food items.
Cool. So if I just share the website, they'll be able to find that.
Yes.
That's great. That's great. Yeah. And what's the best way? I meant to ask you this earlier. What's the best way for people to find providers that provide ketamine therapy? Is there a website where they can locate a physician?
So there's an organization called ASKP3. It's the American Society of Ketamine Physicians. And they do, I think, maintain a directory of people who are providing these treatments. But really, Google is a good resource to be able to find clinics in your area.
Okay. Yeah. I did have one patient who used the ketamine therapy, and he did not have good success with it. But I've only one patient though. So
and it doesn't work for everyone. And I think that's an important thing to emphasize is even though we talk about TMS or ketamine producing transformational results for some people, it doesn't mean it's the be all end all for everyone. And so again, it takes some experimentation and trying some different things. And but I always emphasize to patients that there's always reason to hope, because there are so many things on the horizon, especially with what's happening in psychedelic medicine. I think we're going to see some more breakthrough treatments in the next 5 years.
Yes, I'm hoping to learn more about these things myself. And is there, I think you mentioned a website, moodrestoration.com, for upcoming integrative psych courses if anyone's interested in learning more about these things, right?
Yeah, moodrestorationinstitute.com.
Oh, okay.
Yeah.
Great. Well, I know I will share all of your information with the audience in the show notes. If anyone wants to get in touch with you or even meet with you at your practice in Montana. And is there anything that you would like to share, last minute wise statements of wisdom?
Well, I think so much about what have we learned in the past year with the challenges and the experiences with the pandemic. And I think one thing is we've learned so much about the importance of social connections. And even before all of this happened, we were experiencing an epidemic of loneliness and disconnection in our society. So just really thinking about the importance of bolstering those connections, even if you can't be with people in person, finding ways to really find meaningful relationships is so important to mental health. And then also just really keeping the conversation open about mental health. There's been too much stigma for so many years. But again, with the pandemic, we know that rates of depression and anxiety and alcohol abuse, even suicide, all of these things are escalating. And so it's more important than ever to really keep this dialogue about the importance of mental health going and to seek help if people need it.
Absolutely, absolutely. There are multiple root causes that are in the biological realm, the psychological realm, the social realm, meaning the environment,
Yes.
and the functional realm.
Yes.
So,
Yeah.
so yeah, I'm so happy that you were able to join us today and talk about TMS and ketamine therapy and psychedelic drugs.
Yes.
And your experiences with, and your husband's experience especially too. It's always good to share those kinds of personal experiences to let people know that there's always going to be a way to get better, to get treatment for your depression, and you do get well. You do, if you really address, find and address these root causes. So there's always hope out there.
Absolutely.
Yeah. So thank you, Dr. Amato, for joining
Yes.
us. I really appreciate it.
Thank you.